Hey guys, so welcome to another one of our videos. And in this video, we're going to be talking about offering free safety checks, right? Just to be able to acquire a patient or a client for your home health, your home care agency can actually cause you and your agency to receive some monetary fines. And that's what we're going to be talking about in this video, okay? So let's go ahead and get started. So home health agencies that are offering these assessments for Medicare beneficiaries that are about to have orthopedic surgery may actually face encounters with federal enforcers and face a lot of sanctions. So there's a lot of agencies offering these type of assessments just to be able to grow and gain referrals, right? I want you to make sure that you heed to this warning. Under the Inspector General, they have stated that free assessments can be a way for these agencies to be zapped of their Medicare anti-kickback and beneficiary inducement violations. So pre-op visits should not be used, and you should not be doing this. Even if there are physicians or ortho doctors out there that are telling you that you need to do this in order to be able to gain referrals. When you get these offers, right, or these requests from these orthopedic physicians, make sure that you refer them to the rules and the regulations that this can actually cause problems, because this will cause problems for you as well as those physicians and your agency, okay? And at the same time, as you educate them, they will appreciate that. The good ones, that is. The Office of the Inspector General has concluded that companies' safety assessment may put it at risk of civil, monetary penalties, severe monetary penalties, based on answers to the basic questions I'm going to share with you. Is the free assessment, does it constitute a remuneration of a beneficiary? Or are there free home safety assessments that could actually influence the beneficiary's choice to provide, for your company to provide the care for them? If the answer is a yes, then you have some problems. Are telephone assessments so inexpensive that they have only nominal value to the beneficiary and so would be a subject to civil monetary penalties? Remember this. Those are the questions. Remember, the OIG allows home health agencies and other providers to give a beneficiary, right, services of nominal value only. So what is nominal value? It is defined as $10 for each thing given to an individual beneficiary, up to only $50 maximum annually. That does not mean that you can give them a $50 item because you met the year criteria. You still need to divide that into at least 5. You can only give up to $10 per incident, up to $50 within a whole entire year. Okay? You need to understand this, that offering assessments without charge, obtaining and recommendation of the patient's own healthcare professional, and using a therapist to be able to perform the assessments and that service may appear calculated to be able to gain those referrals for that company. So make sure that when you're dealing with an ortho physician, that you do not succumb to their request for you to provide those free home safety assessments for them. This is actually something that they should provide. They themselves should provide it if they need to. And honestly, you as a person who's hopefully wanting to gain that referral from those ortho physicians to do these free home safety checks, you want to be able to avoid this, and you should have a policy and procedure on what would happen if this was asked of you. At the same time, you should have educational-based marketing materials ready at your fingertips to hand over to these physicians who are requesting for these services, to be able to explain to them that this may be a thin line of crossing that may be considered an kickback. So you definitely want to be able to make sure that you guys pay close attention. Now remember, this is strictly definitely for home health agencies that are trying to get these patients, these Medicare patients, from these ortho physicians. So you guys have to pay close attention when it comes to these things. A lot of people, when they hear these trainings of ours and they see this video, they get shocked and they're like, I did not even know that that's how it was. And so that's why we're making these videos. That's why we're creating these programs and this training, because we don't just want to show you how to be able to get more patients, but we want to be able to show you guys how to be able to get patients, but how to do it the right way and to stay within the borders of what is legal. So if you want more videos, keep on watching. Thank you so much. Have a great day.